Hello and welcome to Crack the Boards. In today's video, we will focus on USMLE questions related to microbiology. Let's have a look at the first question. An outbreak of infectious diarrhea has occurred at a daycare. The affected children present with symptoms such as nausea, flatulence, watery diarrhea, and fatty stools. The causative organism shown in the accompanying image is most likely which etiologic agent? Option A, Cryptosporidium parvum. Option B, Entamoeba histolytica. Option C, Giardia lamblia. Option D, Salmonella enteriditis. Option E, Yersinia enterocolitica. The correct answer is option C, Giardia lamblia. Giardia lamblia is the cause of the outbreak. Symptoms of giardiasis include non-bloody diarrhea with foul smelling, fatty stools, abdominal cramps, and flatulence. The organism can be detected in the stool samples either as a motile trophocytes with 2 nuclei or cysts with 4 nuclei and 4 parabasal bodies. Let's have a look at why the other options are incorrect. Option A is incorrect as Cryptosporidium parvum causes large volume watery diarrhea, especially in immunocompromised patients. Option B is incorrect as Entamoeba histolytica causes dysentery with bloody diarrhea, abdominal pain, and cramping. Entamoeba histolytica trophocytes have only 1 nucleus, whereas the cysts can contain up to 4 nuclei. Option D is incorrect as Salmonella enteriditis is a common cause of foodborne enterocolitis. The symptoms of salmonellosis include nausea, vomiting, diarrhea, which is usually bloody, accompanied by abdominal cramps, myalgia, fever, and chills. The laboratory diagnosis involves isolation of the pathogen on culture media. And option E is incorrect as Yersinia enterocolitica is spread via contaminated foods or water and causes gastroenteritis-like symptoms including fever, diarrhea, and abdominal pain, usually around the right lower quadrant, and it mimics like a presentation of appendicitis. Let's have a look at the second question. A 5-year-old girl is brought to the emergency department after being ill for 8 days with fever, headache, and muscle pain. She also has a particular rash on her wrists and ankles. Her parents recall removing a tick from her back before the symptoms began. The rash has since spread to her face, neck, and chest, and her face appears swollen. After admission, she develops disseminated intravascular coagulation, which progresses to shock and ultimately passes away. What is the most likely cause of her illness? A. Anaplasmosis. B. Epidemic typhus. C. Ehrlichiosis. D. Q fever. E. Rocky Mountain spotted fever. The correct answer is E, Rocky Mountain spotted fever. The history of a tick bite, rash that began on the extremities and spread to the trunk, and fulminant nature of the disease with disseminated intravascular coagulation and shock are highly suggestive of Rocky Mountain spotted fever. The disease is caused by Rickettsia rickettsii, an intracellular bacterium that is transmitted by ticks. The rash does not spare the palms and soles. Let's have a look at why the other options are incorrect. Option A is incorrect as anaplasmosis is transmitted by ticks and presents similarly to Rocky Mountain spotted fever, but has no rash. Anaplasmosis is diagnosed via peripheral blood smear, which shows moruli in granulocytes. Option B is incorrect as epidemic typhus is a loose-borne disease caused by Rickettsia prowazekii. The prodromal period is characterized by influenza-like symptoms followed by a maculopapular and pedicular rash that starts on the trunk and spreads peripherally, sparing the face, palms, and soles. Option C is incorrect as ehrlichiosis is transmitted by the Lone Star tick, which presents similarly to Rocky Mountain spotted fever but without a rash. Ehrlichiosis is diagnosed via peripheral blood smear which shows morula in monocytes. And option D is incorrect as Q fever is characterized by flu-like symptoms followed by pneumonia and hepatitis. The causative agent is Coxiella burnetii, which presents in animal reservoirs such as cattle, sheep, and goats. Human acquired the infection by inhalation. Let's have a look at the third question. A 34-year-old woman with a history of intravenous drug use presents with acute fever, cough, dyspnea, and joint pain lasting for 1 week. Physical examination shows multiple petechiae on the buccal and conjunctival mucosa, subungual hemorrhage on the right index finger, and hemorrhagic macular painless lesions on the left foot sole. Chest examination reveals a holosystolic murmur, and the abdominal exam notes splenomegaly. Laboratory results show significant leukocytosis. What is the most likely diagnosis? A. Enterococcus faecalis. B. Staphylococcus aureus. C. Staphylococcus epidermis. D. Staphylococcus saprophyticus. E. Streptococcus mutans. The correct answer is B. Staphylococcus aureus. The patient has developed an acute endocarditis as characterized by the fever, rot spots, splinter hemorrhages, Janeway lesions, and new onset murmur. The most common cause of acute endocarditis in intravenous drug users is Staphylococcus aureus. Let's have a look at why the other options are incorrect. Option A is incorrect as Enterococcus faecalis is typically associated with subacute endocarditis that has an insidious nature. However, this patient's symptoms are more consistent with acute bacterial endocarditis. Option C is incorrect, as Staphylococcus epidermidis can cause acute endocarditis in intravenous drug users, but it is not as common as Staphylococcus aureus. Staphylococcus epidermidis is the leading cause of prostatic valve endocarditis. Option D is incorrect, as Staphylococcus saprophyticus does not typically cause endocarditis. It typically causes urinary tract infections in young women. Option E is incorrect, as Streptococcus mutans is a common cause of infective endocarditis. This source of infection is typically the patient's own oral flora, which is its neglected teeth or dental procedures can result in spread of bacteria from the oral cavity into the bloodstream, followed by colonization of heart valves. This concludes today's set of questions. Thank you for watching today's video. If you enjoyed it, please don't forget to subscribe to stay updated on the latest content and support our journey.